So, okay, so we've got quite a few people on WebEx, which is excellent. Sorry for the miscommunication there with a new WebEx license. It's like getting a new version of Microsoft Word. Every time they create a new version, they change where stuff is and how it looks. So, so the instructions were for a previous version, so I had to modify them and send out the revisions. So just wanted to do a roll call here just to make sure that I know who's available. I've got the teleconference line open, but it doesn't sound like anyone's on teleconference right now. Okay, so so we have got, today we've got Jens, and whereabouts are you from, Jens?
St. John's.
St. John's, excellent. Okay, and then we've got Jill on the line. Jill, can you hear me?
Yep.
Okay.
Yep.
Excellent. And Jill, you're from?
Comox.
Excellent. Okay, right across the country here. And we've got Kara on the line. Hopefully she, yeah, just unmuted her mic from Halifax. Hi, Kara. Can you hear me okay?
I can. Hi, Jonathan. Can you hear me?
Hear you as well, so we're good to go. And we've got Lori Lundy.
Hi.
Hi there.
I'm from Petawawa.
Excellent, from Pet. And then we've got Stephanie Popovich.
Yes, from Kingston.
Excellent. Okay. Fantastic. So we've got great representation today. So hopefully we'll have a good discussion. I did create a few slides here just to start off the discussion, but I'm hoping to leave the majority of time to you guys so that you can offer your feedback in terms of what makes sense, what doesn't, any questions that you have, and that kind of stuff, since it's been a little while since we've been together. So if you're ever having trouble with the audio at any time, feel free to dial into the teleconference number at the bottom of the slide or in the email that I sent you as well. So my name is Jonathan from Military Family Services. I'm the lead on performance measures at with the team here at headquarters. And most of you have seen me many times before. I'll just be recording this session. Let me know if you have any issues with that. But I want to make sure, for maximum transparency, that we record these sessions of feedback. And then what I'll do is I'll just convert them and upload them to YouTube, and then put the YouTube link on our Performance Measure Tiger Team website. And that way, if anyone hasn't had a chance to participate today, at least they can see what the discussion was all about and stuff. Because I know there was some, especially ever since the beginning of these dashboards, there was a lot of consternation about how they were going to be used and fears that they might be used to change funding or something like that. I'll be discussing about the fact that no, that's not the case. But just for transparency purposes and to make sure that we eliminate any worries about what the dashboard is going to be used for, I like to put all this stuff on the website just so that everybody knows what's going on. Okay, so doesn't look like we have any new members. And anyone on the phone line yet? Okay, great. So we've got everybody hooked into WebEx. By the way, as well, if you're having trouble with your audio and just want to chat, you can always send a chat to all participants at the bottom right there, just like the old version of WebEx. You'll see up at the top of the screen here, we've got two tabs, one for my slides and the other one for the form that I sent you guys, basically a very draft version of what the MFRC dashboard might look like, to get your feedback on that. So let's get started on these slides here. So basically, this is kind of a review of what I talked about, I think it's like a year and a half ago now, about what a dashboard is and isn't. So basically, a dashboard is meant to be very much an at-a-glance set of indicators that should be used for strategic decision making. So as you guys know, being involved with performance measures, measures aren't very useful in and of themselves. Basically, they're the start of a conversation in terms of, I wonder why that number is like that, and how is the number collected, how reliable is the data, and then you look at, oh, well, what does that mean for our organization? So basically, it should be the start of a conversation. It shouldn't just be the be-all and end-all getting some particular number. So a dashboard is also a way to measure organizational health and effectiveness, and that includes levels of staff health, board governance, financial health, and client satisfaction. What it's not, or what it shouldn't be, is basically a collection of random, confusing, and overwhelming information. And I'm sure you guys have seen some of those spreadsheets that are like 200 rows long and have actually, oh, I forgot to mention, my colleague from Military Family Services, Rachel, is just joining us today as well. You can't see her, but she's on the other side of the camera here. She's been helping me out with performance measures, both for the Veteran Family Pilot Project as well as performance measures for Military Family Services. Hi. So Rochelle is here, and she has noticed as well that lately, in the last few days, Rochelle and I have been dealing with these rows and rows of data, and really a dashboard is meant to boil down all that stuff and make it very simple to look at. So it shouldn't be overwhelming information to receive, which is why it's fairly stripped down. You can see on the first page there. It's also not an in-depth analysis of the issues. Like I said, it's not meant to be something in and of itself. It's basically supposed to be a beginning of a discussion in terms of, oh, look at that, look how we compare to our peers and to the national average. These are some of the reasons why that might be the case, and this is what it means for our organization and some of the strategic decisions we're making this year. And it's definitely not a way to punish MFRCs. I know a lot of MFRCs were worried that, you know, this is going to be a grid that somehow is going to change our funding or something like that. It's completely separate, which is why we made the service delivery portion of you submitting your numbers for service delivery completely separate from submitting your numbers for funding, just so that we do have that division between the two. So I just wanted to actually just outline a few of the key components of what you're looking at in the attachment I sent to you, the sample MFRC dashboard. So basically you've got the first page here. Hopefully, let's see if I can, I'm just going to try to make your session window look like mine, but it doesn't look like I can do that. There we go. So you've got the first page here, and basically it's broken up into, so you've got your MFRC numbers would be in the first column, and then that's next to your cohort or your peers, and I'll be talking about that more in just a sec. But then the third column is the national average, so that's across all MFRCs who have submitted their stats. And then we've got the target percentage. In some cases, the target percentage is based on an industry average, as we've talked about in the Tiger team in the past. And in some cases, we'll only establish that target after several years worth of data because we don't really have an industry average for some of these indicators. So you can see that I've also divided it down into people, resources, and stewardship, basically just to give a sense of, so why are we gathering these indicators? Because we want to have indicators of health in terms of how healthy are the people, how well are we doing in terms of resources, and how well are we doing overall in terms of stewardship. The second page, if we just skip over to that, is mentioning the cohorts. So you'll see that you've got the three cohorts, which is small, medium, and large MFRCs next to the national percentages and the target percentages. Now, a bit about the cohorts. Rachel and I, we talked a lot about, you know, and we talked with some of our peers here at in Military Family Services, what's the best way to divide this up? Should we divide it up into dispersed populations, or small, medium, and large centers, or based on military families or number of military family members, which means the family numbers as well as the numbers of children. And we finally decided, okay, let's keep this simple. And even though it's not a complete apples-to-apples comparison, it might be more useful for you, which at the end of the day is what this dashboard is for you to make decisions on. If you could see what your numbers look like compared to an MFRC of about the same size. It's not saying it's the exact same community or you're dealing with the exact same issues in that community or demographics, but at least it will give you a better idea than if you're a small center and then you're trying to compare yourself to a center that's very large in comparison and in a very different context. So that's how we decided to split up the cohorts, and that's one of the things that we can talk about today in terms of what your impressions are. Now, in terms of the cohorts, how they're split up, you'll notice on the glossary section that on the very last page, I believe it is, we've got a description of the cohorts, at the bottom there. So you can see it's split up between small, medium, and large locations. And the reason why we just chose the number arbitrarily to have a fairly good sample size, but also so that we wouldn't have too few in one category or too many. But also we chose family members as opposed to families because some communities have a greater percentage of children in the communities just based on their location and the demographics at their location. And that really does have an impact, I believe, on the burden of effort of programs and services. Because if you have more children in a particular community, obviously you're going to be offering more services and programs likely. So we chose to go with family members, which includes the number of families plus the number of children. So that's just an explanation of that. And just on my slide, going back to the slide here, I just said the last section is providing a glossary and an explanation of the indicators. So that was all I had to say as a preamble to what you're looking at here. So let's start with Kara, actually, who has her hand up with one question.
I just had a question about the cohorts, Jonathan, and how they do divide up. How many MFRCs have you got in each of those categories?
Okay, so I think that I'll check with Rachel because, like I said, she has been working very diligently to split these all up. I think we have about between about 7 to 9 MFRCs in each cohort, somewhere around there.
Okay.
Yeah. Any other questions from the field or comments or things that you don't understand? Okay, well let's just go around the table then. Jens, what are your impressions of the dashboard? How useful it is? How it's laid out? Any ideas about how to make it better or more useful for you at the MFRC level?
No, actually, I find it pretty straightforward. There's not too much that I mean, until we actually get the numbers and see how they transpire and how we can, you know, how they compare, well, yeah, then that will be the question. I mean, right now, looking at percentage signs and what we can do and how it's broken up, you know, I don't have any concerns or anything with that. Like I said, once we get the numbers and start to compare, then we'll see how it goes.
Exactly. And I think that just on the point of when you get the numbers, that should be relatively soon, hopefully in the next few weeks, because what I'd like to do is then get your impression. It'll probably just be the same sheet, but it will be filled in with your numbers, and those of the national averages and the cohorts and the targets that we have thus far. And I'd like to get each of your feedback from each of the MFRCs in terms of do these numbers make sense and that, because when Rachel and I were looking at the numbers, we have a feeling that there are a few outliers which we knew that there would be when we were going through this with the Tiger team. So I think there are a few people who are calculating certain numbers differently than others. And so this
the system has detected that a few lines are still connected to the
sorry about that.
And will attempt to end. If you wish for the lines to remain connected, please press any key.
There we go. Actually, I'll switch it off for now. So hopefully those people who haven't joined us yet will send me an email if they need on the teleconference.
Just one comment, and that would be, and I appreciate that you did break it down with small, medium, large, and for your cohorts, so you're comparing apples to apples. Your targets, what you'd like to, achieve, what to that won't be, for some of these I can see challenging to set a target for, like for example, staff turnover. You'd like to have like what would be your, like a number that you could assign to that, or some kind of value that would be your national target. Hopefully you're not going to go through a period where you're going to have a great deal of staff turnover. And I'm just picking staff turnover because it's one of the first ones that comes to me. Unless you have a significant impact in the economy or something with regards to your center that would throw that number completely out of whack. I mean, you're going to might have some staff turnover. We're pretty fortunate for here. We have our same core staff for years. Some people come and go, but to say, well, this is our target is probably maybe, I don't know if a percentage, but maybe a threshold or something what you're looking at. But sometimes assigned numbers might be a little bit not accurate and something you have no control over.
For sure, yeah, and that's one of the reasons for this exercise. I mean, this is the first year that we're actually looking at these numbers this way. So there'll probably be a little bit of tweaking in terms of targets, the kinds of questions we're asking, the guidance that we give to ensure reliability, that it's all being calculated the same way at the local level and being interpreted the same way. But in terms of the target for staff turnover, what we chose was the national average across all not-for-profit industries in Canada. But what we had to do in that case was one thing that you guys often deal with is postings that increases your turnover rate. So that would not be comparing apples to apples if we compared MFRCs just to with the raw data of the average industry. So we actually took out, that's why we asked two separate questions in terms of the staff departures not due to postings, so that we can actually remove the aspect of postings from the percentage so that we have a better idea of what the average turnover rate is. But you're absolutely right. Having said that, it could be that some of the industry averages still won't be terribly reflective of the reality at the MFRC level. So that's one thing that we'll have to look at in the next few months when we're looking at these.
Okay, great, thanks.
Yeah, Jill, do you have any ideas about how to change this to make it more understandable, or any questions?
No questions yet. I'm pretty new to this position, so I'm just kind of sitting and taking it all in, and I'll send questions later if I think of any.
Sure. Okay. Sounds good. Yeah. And hopefully, I mean, I'm always open to having any kind of, if you guys want to, for instance, if you're showing around these numbers, of course, the risk with numbers is that they start getting spread around, and people say, what does this mean? And does it mean this? Does it mean that? And often get the wrong interpretation. So if you find that within your agency that there are certain people sort of, there are people making extrapolations or generalizations and stuff, and just need some help in terms of figuring out why we develop these numbers, how we develop them, and offering some feedback to us, then I'm happy to set up a teleconference with any of the MFRCs, and we can have a whole bunch of your staff present if you think that would be useful. So as you go through this and you start to see the numbers filled in and you have more questions, if you find that would be useful for me to have individual teleconference with your MFRC, I'm happy to do that as well.
Okay, great. Thank you.
Yeah. Kara.
I think it looks good, Jonathan. I think until the numbers come in and we see what the outliers are, and I can't imagine that, well, you have them. I'm sure there's going to be outliers, and so we've talked about some of those concerns on how each of us has interpreted the numbers, so we'll see. A couple things on the targets.
Yeah.
One around, I know we've gone back and forth on the Tiger team around the volunteer to staff ratio and whether we're looking at numbers or whether we're looking at hours. And I know we talked about in the beginning, I know you had mentioned Red Cross as one of the possible targets to use. I think that's still really off. So the example I would just give to you is we have 30 staff. So if we were to look at that, that would be the expectation that we'd have 600 volunteers.
Right.
There is no way that we will have 600 volunteers. So right away, that one is pretty skewed. So what I heard you say earlier, Jonathan, is that some of these you might want to see over a year or two to see what the MFRC, like overall, what does that look like as you develop your numbers? What is that for MFRCs? This may be one of those because I don't think the Red Cross is an organization that you can compare to MFRCs. Yes, it's a nonprofit, but just in terms of the size and what that looks like, that one makes me really nervous. There's no way we would come close to 600, and we have a strong volunteer base. So that one looked a little bit. The other one that's kind of tricky is the board training, and you're looking at 100% target, having reviewed the manuals. And we certainly do have really strong board training here in Halifax, but it may not be centered around those manuals. So I know that we did have the opportunity to give more information when we submitted the numbers, but for instance, when our numbers come back, they may not look, we're not at 100%, but yet I would say that in terms of stewardship, we have strong stewardship and other tools and other mechanisms have been used, but that's not reflective in that number. So that's the tricky part, and I understand you're trying to pick numbers that are as, you're trying to pick something, so I get that. But those ones in particular, I can see do not necessarily reflect the success that I feel that we have or that other organizations similarly do. So those are a little tricky at the moment.
Okay. Okay, excellent. Okay, that's great feedback. Just writing down a little note to myself here to remember that. Okay. Okay. Excellent. Oh, Jens, you had a question?
Yeah, I just wanted to get some clarification on the ratio of volunteers to staff, because I'm just reading the target, and it says an average of 20 volunteers for one staff full-time in volunteer management is considered good practice for nonprofits. So essentially, if the way I'm reading that is if we have, for example, one full-time staff, then if you had 20 volunteers, you're making your target.
Yeah.
Okay, not necessarily how many staff you have, it's just your number of full-time staff that's managing volunteers.
That's right, which is why we had you guys estimate the number of FTEs that you have engaged in volunteer management. So you add up sort of all the 0.1 FTEs and stuff like that associated with volunteer management if you have several staff who are managing volunteers. That adds up to an FTE and then leads to a ratio. But having said that, like Kara said, maybe Red Cross is not a good way of a good target to use as a benchmark. One thing that we're finding with some of our numbers here in military family services is there's no, because we're measuring ourselves as well, right? And there's no benchmark or even industry targets to go for. So what we're having to do is we're taking several years worth of data, figuring out what the trend is, and then establishing targets on that. So like I said before, some of these targets may change and may be based on several years worth of data, particularly where we don't have any sort of viable industry benchmarks.
But thanks for the pickup. I didn't see the full, I didn't take in the full-time equivalent, because we certainly would not have put 30 staff at full-time equivalent in volunteer management. So that would reduce that number. So that is, thank you. Yeah.
No, because when you mentioned it, it kind of frightened me there for a second. I had to take a second read on it.
Nope.
Yes, we have 60,000 volunteers. No, that was one of the issues. And to tell you the truth, I mean, there's a high degree of variability even among not-for-profits in general. As to the ratio of staff to volunteers. So I tried to pick a viable average, but again, as we go through this first year as kind of a trial year of looking at the numbers, we may determine that it's that we need to modify the targets.
Okay, thanks.
Mm-hmm. Okay, so Lori, did you have any observations or comments to make?
Because I'm sitting in for Claudia, this was kind of a last-minute thing. So at quick glance, it looks like it makes sense.
Yeah.
And I don't have any specific questions at this point,
Okay.
but I agree with what was said earlier in terms of the once the data is in and we can see it, then I imagine that there will be definitely some questions following that information.
Yeah. Yeah, absolutely. And I'm hoping that it was our hope when we first began this process that not only would this give you some information for making strategic decisions, but hopefully we know that a lot of MFRCs don't just go to MFS for funding. You get funding from many other sources. So hopefully this can also be a way that you can present your business, or a different way of presenting your business in terms of showing the reality of staff turnover, the reality of how much money you spend on staff training. These kinds of things can be very useful when you're applying for other funding as well, because of course funders love their numbers. So so it's hopefully that'll be a useful tool for you guys as well as you look at your business and you're engaging in AGMs and all this kind of stuff. So yeah, please do send any feedback that you come up with along the way.
Absolutely.
Okay, and Stephanie, did you have any comments?
Jonathan, I'm sitting in on behalf of Colleen, as you're aware. It looks pretty straightforward to me. I think for us here at the KMFRC, it's the interpretation of each MFRC that we're interested in seeing how everyone is recording everything. And I think that's our biggest question right now, just to see if we are on track.
Yeah, and by the way, just to speak to that, thank you for bringing that up, because I forgot to mention that as well. In the next few weeks, we're going to be contacting a few of the MFRCs who are the outliers, whose numbers are far off from the average, both the national average and the cohort average, just to check and see, was this an entry error, or maybe they were interpreting the question differently, and that just we want to make sure that we don't freak people out when we're sending them the numbers and they notice that they're totally different from their cohorts. We want to make sure that we're using the right numbers. So we will be contacting a few of the outliers in the next few weeks, just to say, you know, you're about 1,000 times more than your average peer here, so that might be an entry error, or how did you interpret that question? Okay, yeah, Kara, you had a question. Yeah.
In terms of the outliers, so is that going to affect our average, your numbers as well, because you are including them in your numbers?
Yeah. So what I'm going to do is we're going to speak with the outliers over the next few weeks and figure out what the real numbers are, and then we will include the numbers in the average. Now, if the I have a feeling that the ones that are way out that would skew the cohort and the national average will probably be brought down, because I think it really is an entry error given the magnitude of difference.
Okay.
So if there is a huge difference, then we'll have to look at possibly removing that from the average and just putting an asterisk beside it saying, you know, one of the centers was removed due to it skewing the average.
It may be worth having a conversation about the outliers after you've gone back, just because the assumption that, like, that shows perhaps that they interpreted differently, but the assumption that those didn't interpret it differently and their numbers still look the same is perhaps false too. So it'd be worth some conversation, because it'll be interesting as you discuss with them. But I mean, that was one of our concerns from the get-go with the Tiger team, is that each of us are going to interpret this to the best of our abilities, just as I did my little quick read over there in the target, and we'll submit numbers, but are we doing it the same way? So it might be, I wonder if, did you see that some of the outliers are in specific categories, or are they all over the place? Or different measures, rather, or are they all over the place?
It depends on a few of the measures. There were some outliers. Rachel, do you remember? Was it specific measures, or was it kind of a number of them?
It varied. Well, some of them had more than one. Yeah. And I think it's based on some of the discrepancies, like in entering the numbers. Yeah. While others did really well, like so it varied, and there's nothing very specific. It changes from one center to the next. Even if when you're comparing it from small, medium, and large, it happens in all categories. Yeah.
Yeah, I would imagine. Yeah.
Yeah, and that could be it could be from a number of things, right? It could be an entry error. It could be because there were multiple people entering numbers, and then it was there was some duplication of numbers that were treated as cumulative, and therefore artificially expanded some of their numbers. And so that's why I'd really like to speak with the MFRCs one-on-one, just to find out what. How they were interpreting the question and how it was done.
Right.
Yeah. All right. So now that we've sort of done the round table, are there any questions that came up? I know we're only at 1:30 here, so half hour in, but I don't believe in carrying it forward just for the sake of holding a meeting, because I know you guys have other things to get to as well, but I'm happy to field any questions. So Jens, you had a question there.
Yeah, well, as I read through this, and I understand where you're coming from, you do a lot of your background information is dependent on, you're looking at the not-for-profit sector. Yeah. And I, of course, I understand that, but and when we look at some of these things, for example, staff training and a few other things, staff turnover, these are global issues that would apply to the public sector, not-for-profit sector, the private sector. So when you guys do some of the research and background information on this, wouldn't it be prudent to include some of the information from those sectors as well? I mean, I've did some benchmarking projects and stuff like that, and when I do, it's amazing when you go and you look at what the private sector does, because their objective is a little bit different than ours. They want to make money, but they try to do it as efficiently and effectively as possible. Yeah. So there's quite a few similarities there. So would there be any, or are you planning to do any of the research on this outside of the not-for-profit sector?
Yeah, and we have looked at a number of averages across various sectors, and that we tried to keep it mostly to social services sector and the not-for-profit. But we did have a look at some of the private industries and some of the some of the not-for-profits. I remember looking at international study by not-for-profits in international development, and some of their volunteer numbers were just outlandish, because the reason is because they mostly work with volunteers.
Sure.
So you'd have like 1,000 volunteers to every staff member. It was just ridiculous. So some of them just didn't seem to be terribly representative. But yeah, I mean, if as we're going through this, like I said, if the targets don't prove to be very useful, or it's more useful to pull in some of the private sector or other sectors outside of not-for-profit in order to make it more representative of what the MFRCs are doing, then I'm happy to do that. The purpose of the target is just to give us a basic idea of how we've been doing thus far and where do we want to go. In terms of, and why do we want to get there, right? Like, why would we want to reduce staff turnover? Because of the reasons, because of the amount of cost to the agency, in terms of time, in terms of pay, covering the person's job as as you're bringing on new hires and all this kind of stuff. So hopefully it'll lead to a bigger conversation within your community, and chances are when you look at each one of these indicators, probably the reason why I didn't, when you look at this, it's a pretty stripped down version, and the reason why I did that is because you guys as the MFRCs know your community best, and so you'll know best how to interpret each one of these numbers in terms of saying, oh, well, our volunteer ratio is much, much less or much greater than our cohort for this reason, because in this community we find that right? So you will probably develop your own sort of storyline and script around some of these numbers, which hopefully will enable you to approach funders with some data that you can say, this is data that's gathered on the national level, that will allow you to speak to your base wing commanders in terms of, this is how we're doing with regard to our cohort and the targets, but also will inform a lot of your decision-making meetings in terms of, okay, given that our staff turnover rate is higher than the average cohort, for example, what does that mean for us? Is that leading to a lot of staff stress? Are there ways that we can deal with that at the local MFRC level? So hopefully that it'll just help with all of those processes. Does that make sense?
Sure, perfect.
Yeah. Okay.
We got to start somewhere.
Exactly. Yeah.
Right.
And I know I mentioned before in previous meetings that as the reality changes in terms of your demographics and military family life changes, we may discover that some of these indicators are no longer useful. They don't provide useful data, in which case I'm happy to start looking at what other indicators might be more useful to gather. So as the demographics change, as military life changes, we're going to have to keep this a fairly fluid process in terms of changing the indicators to fit the lifestyles.
Now that the community needs assessment is a national and you're receiving that data, how is that data and this data going to play along together, Jonathan?
Yeah, so the community needs assessment, I think it'll be another piece of the puzzle for you guys, but it's a different audience really, because that's really a chance for you to hear from families in terms of what they feel their needs are, how their needs are changing, how their needs are currently being met. So that really is a formalized mechanism to allow you to stay in touch with the pulse of military families in your community. Whereas this is kind of more organizational based, if you like.
But you're going to put in the one around the quality of life, which, yeah, I still have issues with.
Right.
So if we're taking the quality of life survey, you're looking at family satisfaction, exactly. Yeah. That very much is, so those, what you're getting at the community needs assessment, some of those pieces, so how are those relating?
Yeah, and the family satisfaction, that's based on the QOL survey, the quality of life survey, that's run by DG MFRCs. Unfortunately, the only reliable data that we have on that right now is through the quality of life assessment, which is only every 3 years. And the reason why I left that in there is because it's just useful especially from a national standpoint, for us to be able to keep an eye on that in terms of its trends, as to whether or not it's going down and up in general. But you can see it's actually not broken down by cohort. It'll be a complete national average. Those won't be individual stats for each of the MFRCs.
Yeah.
Yeah. So like I said, I mean, we'll provide the numbers. We'll have a look at them, see what kind of a picture it paints, see how accurate it is. And then, given that this is the first trial year, if it makes more sense to replace a few of these indicators, then we can have a look at that as well, and removing some that don't really make sense or don't provide useful data. Okay, let's just see if anyone else has their hands up. So any last questions before we wrap up as you're looking through this, or something that might have been sparked by something that someone else said?
Having taken a look at all the data, Jonathan, is the family contact and family members served as messy as we thought it would be?
Yeah, the family members served is still, it's one of those things that we're always asked to provide, but is notoriously, and I'm sure you guys, it's the same thing at the local level, you're always asked to provide that to base wing commanders and whoever else, but But really, I have a pretty practiced script around that in terms of how inaccurate that number is. And really what I usually tell people is that until we have a military family ID card that's accepted across the country, and we have scanners for each and every single service that's provided with the MFRCs, we're not going to have a reliable gathering system for that. It's always going to be, you're going to have duplication, you're going to have issues of confidentiality of information that we've run into with that number. So I'm still not thrilled with that indicator. It's in there because they've asked for it, but I will be any kind of reporting of that number will require a descriptor beforehand, basically a caveat saying this number is not terribly accurate, and so we'd be better off actually choosing a number from one of the longitudinal surveys that we have through DGMPRA.
And the other measures that you didn't report on, that you chose some, not the others. Yeah. What reasoning and how did the other numbers look like, whether that be welcome information or childcare or employment or mental health services? So are those going to fit in another dashboard, or are those?
Yeah. So the other numbers that aren't reflected in this dashboard will be in the other dashboards, mostly in the family dashboard. So for instance, when you spoke to the number of family members that you serve through education and employment services and whatnot, those will be represented in a rolled up stat under the family dashboard. And those are some of the numbers where what we've done in order to create a more robust indicator, hopefully, is rolled up all the numbers and then looked at across several years what the data is coming in to try to establish, okay, what's the normal trend here, and how can we then establish a target for moving forward from here.
Okay.
Yeah, so you'll see those are being developed. I was actually just working on the family dashboard this morning. The numbers, both Rochelle and I are pretty bleary-eyed looking at so many tables lately. So we're just trying to make sense of all the data and try to display it in as easy to consume a way as possible. Yep. So you'll get to see those numbers over the next few months as well.
Okay, thanks, Jonathan.
Yeah. Any other questions from around the table? Okay. All right. Well, thank you all for, we're 42 minutes after the hour, so that was a lightning quick team meeting there. But yeah, I know that you guys will have lots more questions once you get the numbers. So like I said, over the next few weeks, we'll be contacting the outliers. Then we'll be sending you with the numbers filled in, at which point we can have another WebEx in terms of, the reason why I waited on that, by the way, is because I thought that depending on the types of questions that you guys have on the numbers, it might be more useful to just have a telephone call with your particular MFRC rather than the entire group. But we'll see, based on what you think of the numbers and what your impressions are and what the feedback is. We can even have both. We can have individual teleconferences as well as a group one for more group-related concerns. So more to come in the next few weeks. So thank you very much, folks, for spending the time today, and you'll be hearing from me soon.
Thanks very much, Jonathan.
All right, thanks, Jonathan.
Thank you.
Thank you.